Please note the views and experiences shared on this podcast are personal and not intended as medical advice. Always consult with healthcare professionals for guidance specific to your situation.
This episode covers the sensitive and heartbreaking topic of premature infant loss. We understand that this subject can be deeply emotional and may bring up difficult feelings for some listeners. If you have experienced loss or find this topic challenging, we encourage you to listen with care or consider skipping this episode. Please take the necessary steps to prioritise your mental and emotional well-being before proceeding. Welcome to the PremiPod, the podcast dedicated to sharing the powerful, inspiring, and often emotional stories of families and healthcare professionals navigating the world of premature birth.
Whether you're a parent, a healthcare worker, or just someone looking to understand the journey, we're here to offer support and insight, one episode at a time.
So tune in as we dive into real experiences and explore the strength of the neonatal community. We're your hosts, Kirsty, Dimity, and Meg.
Welcome back to the PremiPod, everybody. Today we have Kylie Pussell on with us. Kylie is the CEO and co-founder of the Miracle Babies Foundation, the leading organisation and support for NICU families in Australia. Kylie has also been through multiple fertility and NICU journeys, which she is bravely sharing with us today. Thank you. And thank you for joining us on the PremiPod.
Thank you for having me.
Hi, Kylie.
Hello.
So to kind of start us off, just tell us a little bit about yourself and where you grew up, and then how you led into fertility and your pregnancy journey.
I grew up in Tamworth, regional New South Wales, so country girl at heart, and moved to the city when I was about 17. And from there, haven't really left Sydney, I guess. So it's kind of become home, but Tamworth will always be my original home. So I actually got married quite young. So I was married at 21 and we wanted to have a family. And like most people, you just kind of think it's going to happen when it happens. You don't think anything's going to be, any problems there. And sadly for us, there was. So I was diagnosed with polycystic ovarian syndrome, which meant infertility for me and having to go through the IVF journey. So that was really tough. I think anyone who's been through it or seen a family or friend go through it, it's such an emotional journey. It's so up and down. And that fear of not knowing if you will ever have that family you desire is, constantly in the back of your mind. So yeah, we went down the road of IVF.
And were you diagnosed with PCOS quite early on, like as a teenager, or was it when you were trying for a baby that you found out?
I'd always had problems and my mother had taken me to the doctor, but I'd never been diagnosed with anything. So to actually have this diagnosis at 21 and not really know what it meant, but it provided a lot of answers. And then I guess learning and navigating what that meant for us or for me. But the first thing on my mind was, having a baby. So the infertility side, more than the PCOS symptoms at that time, were more of my focus.
Yeah.
Yeah. And so how long did it take until you got pregnant the first time?
We actually, just before we went down the road of IVF, which prompted us to go and have some tests, we did have a pregnancy and I had a miscarriage at 10 weeks. So that was quite devastating. And then on not being able to fall pregnant again was what prompted us to go and seek some help and find out what was happening. And then I got diagnosed with PCOS.
Yeah.
It's really sad, isn't it? Because being a female, you think none of this stuff will ever happen to you. And then when it does, you're sort of like, wow, really opened your eyes to what females go through.
And I think even at 10 weeks, you kind of think that you're almost safe. You're almost at the 12-week mark. You really don't think it's going to happen then.
Yeah.
But it's way more common than what all of us even know. Yeah. They say 1 in 4 pregnancies and a miscarriage. So it's not 1 in 4 women, it's 1 in 4 pregnancies, which is actually really, really high. Yeah. And so then did you go through a gynecologist, OBGYN? What was your process into doing your IVF?
Yeah, we went through an IVF specialist. We went through 2. We went through 1 and we had a few cycles. And anyone who's been through it, I always used to look at it like hurdles. Okay, when can you start the medication? Then all the blood tests you have in between, then going in for the retrieval and then checking, are they fertilizing? Are they cleaving? Can they transfer? So there's so much involved in that kind of, 4-week period, really. and you're just doing so much to get to the end point to hopefully have a positive pregnancy test. So that took a while for us of goes, unfortunately, but we did fall pregnant, and I fell pregnant with twins.
Wow.
We were super, super excited, of course, and not knowing we had any other issues going on. That was, for us, that was a big, huge hurdle to get past, and we were super excited. Yeah, after what we'd already been through, to be pregnant with twins.
Yeah, that's so exciting. How was your partner? Like, did he come with you to all the appointments, and how was he during it all? Because I know it's a lot, especially for a male. Like, not even just a female. You're going through it because you really, really, really want that baby, but your partner's there along with you. How was he?
Yeah, he was always very supportive and always pretty brave. I could never do the needles, and back when we had it, it was, the
So he did
injections
them
in
all.
the stomach, and I couldn't do it, so he had to do it, and he felt really bad when I'd be laying there crying after a needle,
Oh.
and sometimes they didn't hurt, and sometimes they hurt a lot. It was just, I think, dependent on the angle that the needle might have went in, or skin. So he's always been very supportive, and we've always, I guess, been a good team with all
I think
that.
that's lovely that he was doing them for you.
Yeah, I couldn't have done it myself.
No.
Yep. And so then talk to us about that pregnancy and how far you got through with that one.
With that pregnancy, it was so exciting, and we were just absolutely overjoyed. And I got to, I was about 15 weeks or so, 15, 16 weeks pregnant, and I was traveling down to Victoria to visit my sister for her son's birthday, and my obstetrician was like, yeah, everything's going well, you're doing well, it's a straight road. So we embarked on a couple of hours drive down the freeway, down to down to Victoria, and along the way I started to get really severe back pain. And I just thought, one of the babies are in the wrong position. At this point, I was about 16 weeks pregnant. And so that went on for about an hour or so. And we stopped to go to the bathroom. And as I stood up out of the car, I felt a gush.
Oh, no.
And so, rang my obstetrician, like, what's going on? What's this? And they told me to go to the nearest hospital, which I did. And they did some tests there and said they couldn't find any amniotic fluid, that it just, they weren't.
Wow.
So I then continued on that drive, and we arrived at my sister's in Victoria, kind of early evening. Overnight, I did not get any sleep, and not knowing it at the time, but I was having contractions. The next morning,
Wow.
I was having some discharge, which I went to the local hospital there, and kind of was sent home, I guess, from ED with, no real explanation. And then over several hours later, by the end of the next day, I was in absolute horrible pain, having contractions quite constantly. So I went back, but instead of going to ED this time, I went to maternity, and on examination, I was told that I was dilated, and one of my baby's foot was ready to.
Wow.
No.
That would have been heartbreaking, Kylie.
Devastating and broken. That night, which was meant to be, celebrating with my family for my nephew's birthday, was in hospital in a maternity ward with my husband and my sister. And having to deliver 16-week twins.
That's so sad.
So sorry, Kylie. That's devastating.
It was absolutely, I think, crushing. And to get that far and to have come across all those hurdles we'd already had, it was really, really tough. And then it got even tougher, I guess, over the next few days, which no one had kind of said to me, but my milk came in.
Yeah.
It kind of just felt like, how much more, when you're that broken, how much more can you go through? The feeling of emptiness, but knowing that your body's doing things that it should have done to prepare for your babies.
Yeah. And were you on the maternity ward at this stage, like when you were going through that?
Only overnight, and then I was just discharged the next day.
Yeah. Yeah. That's really hard.
With your milk coming in, did you have supports from like a lactation consultant to help get you through that like tough hurdle after losing your twins?
No, I'm not sure, because I was in a different state, different hospital. But when I was ready physically, took the drive home, and then I just saw my obstetrician when he called to see me and to do some tests and things like that.
And what supports were available for you at that stage, Kylie? Like, what supports were around? Did you have any organisations that you were able to connect with? What was that like?
I did get some printed pamphlets and information around bereavement, so I do remember reading through those things. I didn't reach out, quite a private person.
Yeah.
Definitely going through it a lot and on our own, but we did receive information, and I do remember reading through it and finding some comfort from some of those, other families sharing their stories.
Yeah. Yeah. Did you know if they were boys or girls, your twins?
We had a boy and a girl. Yes, they were all very formed, very beautiful, and we called them David and Angel.
Oh, that's really cute.
Beautiful.
Oh, that's beautiful. That's really lovely. Yeah. And so what did that bereavement time look for you, Kylie? Like how long a process was that for you? How was it for your husband? Like what was that timeline?
It was kind of blurry, I guess, to be honest. I mean, a lot of things changed at that time for me. Like, I wasn't able to go back to work at that point. I was still working part-time, but
And you were not yet on maternity leave as well because you were 16 weeks. So
Yeah.
being off work, unpaid, that adds another stress as well to the whole dynamic.
It definitely does. It's financially tough. Like, I wasn't in the frame of mind to go back to work. I just couldn't focus on anything much. And yeah, we're still trying to save to have, IVF to, when that would next happen. So yeah, it's very tough emotionally and financially.
Yeah, of course.
When did you feel ready to try again? And what did that look like for you? Were you like a couple months later, you're like, yep, let's try again? Or was it like a year? Like how long did it take for you to feel ready to be trying?
It actually wasn't too long. Like, I think when you get to that point, I don't know if it's a bit of desperation, but you kind of, you feel like you're so far, got so far in that pregnancy further than the 10 weeks. Yeah, so we did a few months and we went, but we did go to a different clinic and I got a bit more support around my PCOS as well. So I think that was a good thing for me. And yeah, we've tried a new clinic and yeah, so we went through and we had a great IVF cycle there. And I think from memory, we had like 16 eggs retrieved and
That's amazing.
out of 11, I think, fertilized.
Wow.
That's fantastic.
Got goosebumps.
And then I think there was 9 cleaved. So yeah, it was definitely a different result for us.
Mm-hmm.
And yeah, and we fell pregnant with one beautiful baby.
That's very exciting. With your IVF cycles, did you do like them on natural cycles as well as with the injections? I know that they allow like for natural cycles some clinics as well.
No, I think from memory, ours were like I had the medication to actually stop my natural hormones.
Yeah.
Right.
Cool.
Right.
Yes. So tell us about this pregnancy.
Yeah, so obviously very, very scared as to what was happening, and we'd had as many tests as we could from previous pregnancies. But my obstetrician, who I adore, and he's been through everything with us from the first pregnancy.
Yeah.
So as of 12 weeks, I was having fortnightly ultrasounds at feto-maternal unit because
That's really good.
none of those tests had come back with anything. I was on Clexane injections. I was on aspirin, I think, at that point. So we were kind of trying everything that we could to hopefully stop anything happening again. So fortnightly scans at FMU, and it was the 22-week scan that I went in for that I did not go home from hospital that day.
Wow.
And at 22 weeks, I was taken from FMU straight to antenatal, and my obstetrician came in not long later and explained to me that, my cervix was 0.7 millimeters, which at that point should be 2.5 or over, and that basically told me that if I didn't have this emergency surgery that I would be delivering my baby that day, and at 22 weeks, the baby could not survive.
How many years ago was this, Kylie?
That was 23 years ago.
Wow, because the technology from now until 20 years ago is completely different. So I guess your cervix getting shorter and shorter, it's really scary because you don't know the viability of a baby 20 years ago. You would have been really, really scared.
And also after what you went through with your twins, you would have been even more scared, the extra level.
Yeah, it was really petrifying. And then obviously the risk of having that emergency surgery at 22 weeks as well. So we had the surgery and it was successful. And I spent about a week in hospital until the bleeding stopped and then was allowed to go home. But I was still coming back into the hospital for ultrasounds just to check the cervix again. And I think from memory, I only lasted a couple of days at home. And when I had that first scan back, they were like, you've still got beaking and funneling and your cervix is still, making lots of dynamic movements. So I was put back in hospital on bed rest. And in those days, I don't know if they still do it, but back when I had my children, it was, the bed was elevated with my legs a little bit in the air to take the pressure off the cervix. So when people walked in the room, it was quite shocking. And basically on bed rest with only just, minimal toilet privileges, which is where I was for pretty much 8 weeks.
Oh, wow.
And was that surgery to put a suture in your cervix to stop it from dilating? What was that surgery?
Yes, exactly that. Sorry, yes, I didn't explain that.
Yep. No, that's excellent. And so how long did that suture last for you? Like how long was it able to be where it
it prevented you going into labour?
Yeah, I was discharged just before 30 weeks. So about 29 weeks, I was allowed to go home with the agreement that I would do bed rest at home, which I did. We did that at home. We put back in those days, the big telephone books under the bottom of the bed legs and, tried to elevate our bed a little bit as much as we could. It had worked for 8 weeks, so we thought, it might get us a lot further. But it was only a couple of days and I wake up in the early hours of the morning and my waters had broken. So,
Wow.
so it lasted 8 weeks for me and went into the hospital that day. And I was in labour that night.
Wow. Kylie, that's amazing though that you held on for 8 weeks after the suture. Like that's really well done. Like you definitely did bed rest well. Like congratulations on that. That's a big achievement. That is.
It wasn't fun and it was hard and it's lonely as well. As I mentioned, I didn't grow up in Sydney, so my immediate family, didn't live nearby. So my parents were 6 hours away. My sister was 6 hours away. So it was quite a lonely time. I mean, and friends are still at work and, my husband was working, so he'd come in when he could, but it was really lonely.
Yeah.
I mean, it was nice that I got to, make a lot of connections and friends with nurses. So that was always lovely, but I was in a room on my own, so I didn't really have that much contact for those 8 weeks. But
it would have been really tough.
Yeah, it was. But one thing I do remember was when I did get discharged, and then especially after having Madeline, my daughter, who was born at 30 weeks, it was really, my muscles had kind of just disappeared. Like it was so difficult to walk and to build up the muscles in my legs and things again from being on bed rest for 8 weeks. Like, you don't think 8 weeks is that long, but your body does change in that time.
Yeah.
Oh, yeah, definitely.
Definitely.
Absolutely. And I guess maybe at that stage there weren't physios coming around to help you do some exercises like, passive movements in bed or anything to help you with your muscle.
Yeah, no, there wasn't actually, no.
Yeah. Yep.
So can you tell us about Madeline and her birth and, labour and all of those things?
Yeah, Maddie was born early hours of the morning. The stitch had broken that I'd had put in at surgery, so I was allowed to have a natural vaginal birth. So she actually came quite quickly. She arrived before my obstetrician arrived, so quite quickly, and we got to have a little quick cuddle with her before she was taken to NICU, and then my doctor arrived, and it was nice to have him there at that time as well. But yeah, we got a little cuddle for a few moments, and then she was taken to NICU.
That's good. So she was breathing on her own for a little bit at least?
She was breathing on her own, and she was placed on CPAP once she got to the NICU.
Amazing.
She weighed 1.5 kilos.
Wow.
So
wow, that's a good size.
Yeah, she was on some antibiotics and things and on CPAP for a little while and ended up staying 6 weeks in the hospital. And as you know, like being discharged after, 3 or 4 or 5 days, whatever might happen in your region, it's a lot to go back to and from the hospital. And to be discharged without your baby, like that's not part of how you think it's going to work either.
Yeah, you think you're going to walk out of the hospital with your baby, but you're just walking out with yourself and probably your little milk bag. Is that right?
Yeah, your sterile cups to go do your experiment.
And so what did that NICU journey look like for you? So those 6 weeks, were there any setbacks? Were there any touch and go moments, or was she quite a well baby?
She was quite a well baby. She did really well. 6 weeks. Yeah, it was for us. I can't say that NICU time was super overwhelming. It was scary, but once she was here and she was breathing, we were just so overjoyed that she was here and she had a chance and she was alive.
Yeah, that's right.
So it was an experience that was hard and, a lot of, financially, emotionally, time-wise, all of that quite draining. But yeah, we celebrated her every single day.
Yeah.
The good memories, I mean, obviously, apart from being a mum and getting to take her home, I do have such special memories about meeting some of the other families that were around Maddie at the time. And we're still, all our kids have just turned 23 last year and we're lifelong friends. And that support we had for each other in the hospital and especially in those early years, we've continued that on. And I have such a special bond and special place in my heart for those families.
Yeah, that's really good. You said Maddie only stayed in the hospital for 6 weeks. That's really good because she would have only been 36 weeks when she got discharged, and that's amazing. Like normally a term baby is 37 weeks, so that she even got to go home a week before that. That's crazy.
Yeah, she did really well. It was scary in the first week or two because she was still learning her, suck, swallow, breathe reflex.
Yes, yep. Nailed it.
And so she was still learning that. So it was quite scary for a little bit. But after about 2 weeks, she got her feeding a bit better. And and she was, amazing. And we attended a primary play group through the hospital there. So I got to stay in touch with those families we'd met. And and that was really good support as well from, physio and OT, speech as well. So that we had some, extra support if we had any concerns with her.
That's fantastic. I love the idea of having a primary play group, and it is able to bring parents together as well as get you connected with the allied health team, which, as being a NICU parent, you follow through with the allied health when you go home. So a great way of making connections.
Not only the play group, but the play group being a preemie play group, because, you're really scared of your baby getting sick. So that those parents would be exactly the same is really good.
Yeah. They're onto it with the hygiene, the hand hygiene. If their kid's unwell, they're not going to bring them, they're just that little bit more conscious. Hey?
Like-minded.
Yeah.
Definitely, safe space.
Yeah.
Yep. Okay. And then taking her home, what was that like?
Yeah, it was different again from what we expected. When you take a new baby home, maybe at term, I don't know how different people celebrate, but I kind of had the idea that you'd, go home, baby's first going home outfit, bit of celebration at home. But after being in NICU and obviously not wanting to have a lot of people around for germs and all of those reasons, it was a quiet moment, but very special moment for us. And so we went home and got to take her home with us and start our family life at home.
Well, that's lovely. How was settling her into home? So I know going from NICU to home is sometimes quite a big adjustment for a NICU mum. So how was that?
Yeah, the no monitoring, the no nothing. You're just having just her there with no way of knowing if she's okay 100%. Yeah.
Honestly, petrifying.
Yeah.
You get so used to those monitors and thinking that, if anything happens, you're going to be there. You've got healthcare professionals around you. To going home and then all of a sudden being that primary caregiver is really difficult. And I look back on it now and I don't know, I do know other families do it, but I don't know if it's widespread, but I did kind of keep that diary the same as the nurses had, how much she had to feed when she went to the toilet and things like that. So it was definitely that routine that I'd become accustomed to in NICU was kind of what I was doing at home. But very fearful that she'd stop breathing, that she'd be sick and I wouldn't know that she was sick, those types of things. So I would actually wake her up to take her temperature. I look back now, poor child. I'd do that. I'd always go in and, just quietly listen that she was breathing and things like that. And that was the normal way I knew of parenting. It was all I knew, just to be constantly monitoring all of those things for her.
Yeah, because you had been watching the nurses do it for 6 weeks. So for you, that was normal. That was parenting. Yeah.
And then what did her follow-up look like? Did she need much involvement from allied health and, physio, OT, all that in the first year, speech, all of that? What did that look like for you?
With Maddie, she did have some hand weakness and things like that. So we did physio and OT over about the first two years, I think. So just those kind of things, which we did through the hospital follow-on clinics and then obviously through our local community health centre as well. So she did get some extra support.
Oh, that's lovely. That's really good. And then how is she now?
She's amazing. Very proud of her. She's 23 years old. She's a primary school teacher.
Wow.
That's incredible.
Yeah.
Good job, Maddie.
Doing really well.
Mama proud.
Very proud of the young woman she is.
That's amazing. Fabulous. That's so nice. And then, so when did you feel ready again to start trying to expand your family? Because I assume you wanted more kids than just one. So what did that look like for you after Maddie?
Yeah, we did. So the next step with our obstetrician was to have a cervical suture in place pre-pregnancy. So we had that procedure done, and we went back to our IVF clinic. And sadly, I had a 5-week miscarriage in that time after the surgery. Yeah. And then when we went back to try again, in our heads, we'd had the surgery, we'd been through so much, thinking surely now we get a good run from here. We've had enough. Yeah. And we were excited but very, very scared when we fell pregnant with twins again.
Wow. Yep.
So it was kind of, I guess, a similar obstetric journey with Maddie. So same thing at 2 weeks, every 2 weeks from 12 weeks, I was having the ultrasounds at FMU. I was taking it easy. I wasn't working. So I was home with Matt. But so I was able to when she rested, but as a very...
Yeah, it's hard. How old was she then? How old was she?
This was when she was probably about 1.5 or so.
Oh, that's the hardest age.
Running around everywhere.
I do remember, yeah, come on, let's lay down and watch Barney for a little while.
Yeah. I'll be
Yeah.
happy.
So yeah, it was but it was a nice peaceful time. Like just I
Yeah.
enjoyed being pregnant, even though there was that fear there. And yeah, having the fortnightly ultrasounds every 2 weeks. But for some reason with me or my body, that 22-week mark hit again, and once again I didn't go home from hospital on that 22
Wow.
week scan.
Yeah.
So similar issues, the beaking, the funneling, cervix was not doing what it could, and because I'd already had the surgery where there was nothing more that could be done. So
Yeah.
I was back to bed rest again in hospital and with the legs tilted. So back to where I'd been with Maddie for 8 weeks.
Wow.
Always hopeful I was going to get that same amount of time, if not more.
Yeah. Yeah.
But on this occasion, sadly, it only lasted about 3 weeks. So 25
Wow.
weeks gestation, my waters broke. And
Wow.
for 2 days, I was having that medication. I'm not sure of the name, but the medication to try and stop the contractions.
Yeah.
Yep. I only know what it's called now, which is nifedipine, but I don't know if it would have been the same back then.
So yeah, I think you might be right.
Yep.
So yeah, I was having that, and I'd had steroids as well. So I had received steroids from 24 weeks with both pregnancies. We were doing as much as we could that way. But I do remember on the second night trying to stop the contractions and my obstetrician coming in and him just explaining to me, Kylie, the contractions are too strong. We can't stop them anymore. And because I had the stitch in, there was obviously quite a scary risk that my cervix would rupture.
Yeah.
So I was then wheeled off to emergency cesarean.
Wow. And you had a vaginal birth the first time. So again, this is a new thing for you. Totally scary, especially it being emergency.
Were you like under a GA or an epidural with the section?
So I went down not really knowing any of what would happen in that situation. My husband was all in his scrubs ready to come in, and they stopped him at the door. And because I'd been on Clexane injections, once again with his pregnancy, he was unable to come in and I had to go under a general.
That would have been
scary.
Scarier.
That's so scary. Did you ever get to talk to a neonatologist or someone from NICU before going for your surgery?
Not at that point, but I had met with them on the antenatal ward. So they come and see you when you're down there in the antenatal ward and go through, an outcome kind of scenario booklet if baby was born at this gestation. Yeah, we did have that relationship with the neonatologist and the NICUs. And also having been there with Maddie, we had met families that had babies at 24 and 25 weeks. That little bit of extra understanding, I think, I can't say it made it harder or easier. I think it was just we were more aware that this was going to be a very different road from what we experienced last time in the NICU.
Yeah. So going in for the C-section, you wanted full resus of your babies, is that right?
Yeah, so in that day, 24, 25 weeks was the grey zone, and we had that conversation with our obstetrician, and we had asked for full care.
Yeah, beautiful.
What were the statistics like back then? You spoke about how the NICU team had spoken to you on the antenatal ward. Do you remember what those statistics were about outcomes and what that would look like?
Don't remember exactly, but I think it might have been around 70% survival or something like that. That was probably the main thing that stuck in my head, was survival more than, other outcomes of disability and things like that.
Yeah.
So yeah, we knew enough to be really, really petrified that this was going to be a tough road ahead. And looking back, I think it was probably a good thing that I was actually under anaesthetic, because I can only imagine the trauma at that time when both of your babies are being resuscitated in such an emergency situation and you're kind of laying there after an emergency cesarean. So maybe there was a little bit of something in there that protected me from those moments, because I can only imagine for parents that go through that, how that must really replay in your mind.
Yeah.
Was your partner was there, so he would have seen the twins getting resuscitated, is that right?
No, so he wasn't allowed to come into the theatre room.
At all. Right,
Wow. Okay. And so when did he meet the twins for the first time? Was it when they were already in NICU?
Not sure if they saw him on the way out or if they actually just came and got him and took him to the NICU, but he met the babies in the NICU, yeah.
Just tell us about the NICU. Tell us about when you woke up from your general and what was going on.
How were you feeling?
Yeah, I remember waking up a few times and just saying to the nurse, my babies, and she was just saying, they're in the NICU, they're in the NICU. You've had a boy and a girl kind of thing. And that was kind of the only information I had. So I didn't know that they'd been resuscitated at that time. I didn't know
Yeah.
what their situation was.
Mhm.
So then I was in recovery. Then I was taken down to the ward for a little while until someone could come and get me and take me in the bed, actually, to the nurse, to the NICU. So that was my first visit to the NICU with the twins, was in my bed, as soon as I could after the C-section.
Yeah.
So what was that like, seeing your twins in the NICU for the first time?
It's very emotional, very home hitting. Like, they were in the area where the really sick bubbers are.
Mhm.
They were beside each other, so I could, have my bed there and kind of look either
Look
way.
over at both.
But I think for me at that moment, they were there at that moment, and it was too hard to think about anything any further than that.
Yeah, that's good. And you had like that hope that they would be okay. And you could see that they were there and you were like, okay, we've got this. We'll do anything that we can.
Yeah, it's just moment by moment.
Yeah, that's right.
And what was it like seeing them at 25 weeks? Because had you seen your 16-week twins when you delivered them? Had you had a look at them?
Yes, we got to hold them and had photos.
Yeah.
Well, that's
Yeah.
beautiful.
So what was it like going from a 16-week vision to then seeing your 25-week twins?
A little bit bigger, but very much similar in regards to the forming, the eyes, to the skin, transparency, all of that. But yeah, obviously a little bit bigger. Scarlett was born at 645 grams,
Wow.
and Marcus was 780 grams.
They're actually really good
that's
sizes.
good.
Yeah, it's really good.
Scarlett was on CPAP, which they all told me for a 25-week twin to be on CPAP was pretty
Wow.
amazing.
Yes,
Yeah,
especially
it is.
back then. That is incredible.
Uh-huh.
That's really
Yeah,
good.
and Marcus was ventilated.
Yeah. So was he always the sicker one out of the two of them?
He was, which with her being smaller, we didn't expect that.
Yeah.
Yeah, so yeah,
It's a
So-
lot, isn't it?
Yeah.
it is a lot. Yeah.
And so how was that first couple weeks with them there? They go through a lot in those first couple weeks with stabilization, with getting their sugars and electrolytes and their ventilation right. What kind of things were going on in those first couple weeks?
It was actually the first day, I think, as I said, I got to see them in the bed, and then the next day I was able to go up in a wheelchair and see them. And it was just kind of sitting there. As I said, they were beside each other, so I had, could sit in the middle. But yeah, it was just a surreal day, you know what I mean? Just sitting there still trying to absorb what had happened. The emergency cesarean was really hard physically, like just to move around, to do anything. So that was more than I expected. Like more
Yeah.
painful, I think, in recovery than I expected. But it was on, it was night two. Night two, I remember from when they were born, because they were born in the early hours of a Sunday morning, I think it was. And I had a nurse come in to my bed. I was still in hospital at that point, come over just to tell me that I needed to go to NICU, that one of my babies wasn't doing well.
And was that about Marcus?
Yeah, so I was taken up in a wheelchair, and yeah, all the doctors were around Marcus, and he wasn't doing well. He'd already undertaken he'd already had to have a few blood transfusions. They'd moved him onto the shaky ventilator. I think it's the oscillator. So they'd moved him onto that, and on some scans and tests, his lungs had collapsed. He'd had, major complications. He had major brain bleeds, starting to have fits, and yeah, his little body was breaking down.
I'm so sorry, Kylie. That would have been so much to go through.
And not only that, you still had little Maddie at home and, you're her world and, she's without you, you're without her. It makes it really hard.
It was, yeah. And so I called my husband, came in, and we were just there all those early hours of the morning, just, watching the doctors, keep an eye on him and see how he was going. And he had more scans earlier the next morning. And the neonatologist who was on call that night, who I'm still really close to, she said to me, you should probably think about if you wanted to
It's okay, take your time.
if you wanted to have him baptized or have any family meet him.
Yeah.
And was that basically not the first time, but basically in your mind that felt like it was almost the end for Marcus? Is that what it felt like?
Well, as I said before, things are a bit blurry at times, some of the memories there, because I think you kind of try and shelter yourself a bit from them and how you get through it when you're going to like shock like that. But always having a bit of hope. But I think always from what we were hearing, what we're being told, he wasn't going to, have the outcome or the survival that we were hoping for.
Yeah. And so how long after that was it until he did pass away?
Just after lunchtime, we had him baptized around lunchtime, and then just after lunchtime, he passed away.
Yeah. And did your family get to meet him or was it just you guys there?
Maddie was able to come in, so yeah, she did get to meet him. And my mum and grandma were already down here helping me with things with Maddie, so it was nice that they got to meet him and some of my husband's family as well. But the rest of my family are in regional areas and
it's
here in
hard.
time.
Were you able to hold him before he passed away or while he was passing?
We got to hold him in those hours while he was being baptized and things like that. And when he did pass, he passed in my husband's arms.
Oh, that's beautiful.
But I never got that hold with knowing that he had a chance. I think that's really
Of course.
but the only hold you get is to say goodbye.
You never got a hold when he was okay, when you thought he would be here forever.
So you never had that happy hold, I guess.
Happy hold.
Hopeful hold. It was it was a goodbye hold.
Yeah. And so what did that bereavement time look for you, Kylie, and your family? Was there a specific room? Because at the moment now we've got what's called a butterfly room where families go and you can have your baby in there like on a cold cot and they can be there with you for, however long you need to process. What was available for you?
Yeah, there was a quiet room that it was called at the hospital. So we were there with him and able to stay with him for as long as we wanted.
Yeah, that's
Sometimes in the NICU that we work at, we, bath the babies during bereavement and that you can sleep with the babies and things like that. Did you get to have those experiences with Marcus?
No, not at that time, no.
And so what supports were available for you then? Did they have an organisation that comes in and talks to you? Did they have resources? Did they have bereavement packs that they would give families? Like what was that like?
Can we just take one break for a moment?
Yeah,
of course,
absolutely.
Of course.
Yeah. Yep.
You're so brave.
You're doing so well, Kylie. I know it's really hard to speak about all of this stuff.
And
bring it all back up.
Sorry.
No, that's okay. We take all the time you need, Kylie. Do you need to get some water or, yep, you've got some? Excellent.
But yeah, we are really sorry that we're bringing all of this up. If you want to take a break or anything, you just make sure you keep telling us, okay? Because it's hard to relive.
Yeah. So what we have at the moment is different organisations such as yours. They bring in like bereavement packs, there's support. There's your nurture line that you can call, that has support for families. What did that look like for you at that stage? Was there anything available like that?
When Marcus passed, we had support from social work in those first few days. I felt more comfortable and safer with a social worker who I'd met through when Maddie was there the first time. So she supported us through this, and she was wonderful and very caring and there whenever we needed it. But I guess different personalities, whatever we say, but it's still a bit of a private person, so didn't reach out for a lot of that, dealt with it a lot internally and at home. But the nurses were wonderful. They took, handprints and footprints for us. They got some photos with Marcus with Scarlett. So
that's lovely.
Beautiful.
That's really precious. And that's another hard thing as a mum to twins that I don't have anything holding them together. I've seen that situation. That's a bit difficult, but yeah, they did pop Marcus into Scarlett's humidity crib and take some photos of them together, which is very special for us. It's not something we share. You can very clearly see that Marcus has passed, so it's not something. It's private for us, but it's definitely a special thing that we have that we can see together.
Yeah, and Scarlett will always carry a special part, like a little part of Marcus with her.
Absolutely.
Throughout her whole life,
She does. She's very connected to him, yeah.
And that's probably why she's so strong because, she carries a bit of him.
And then how do you involve all of those times, all of those memories with Marcus in kind of like your everyday life, even like your other angel babies? Like what do you do to involve them in your everyday life with your other children, in those milestones, birthdays? Like what have you done as a family to kind of remember them and include them?
We've always been very open with our children about, our challenges and yeah, so we celebrate, especially with Scarlett and Marcus, like we just celebrated their 21st birthday last month.
Wow.
So, he was mentioned in the speech, we all talked about him and we go to the cemetery. We're quite open with all of that discussion with our families. Definitely, part of our children's lives. Like he's still part of our lives.
Yeah, that's good. And it's good that you talk to your kids about that too, because I've heard a lot of people, they've said like, I've had problems with this in my pregnancy or this in my pregnancy. And then their mum will pop up and say, oh, I had that too. And, it would have been nice to know like previously if
Yeah.
their mum had that, because, you know, they could have prepared themselves, you know, they could have spoke about it and that could have been like on the radar. So it's really nice that you speak to your kids about all of this, keep them in the loop.
Yeah, and definitely, and I think those next few weeks especially were really hard going back in, like all of a sudden now you're the bereaved family, you know, I mean, yes, there's privacy, but when someone's quite broken, it's very easy for other parents to see as you walk past. So I
That's
was
right.
quite distant, I think, in looking back. I wasn't as open and conversational with other parents as I was when I was in there with Madeline. So it was definitely a different experience for us. I remember finally getting my first hold of Scarlett at 7 days. Yeah, it was really tough those first few weeks after losing him and going back to the same place of that trauma every day. There's a few things that certainly stick in my memory. And I know beds get moved around in units, I understand all that, but going in one day and Scarlett was in the cot bed or in the cot space where Marcus was. And that actually triggered me in a way I didn't expect.
Yeah, of course.
Once the staff realised, they moved her quite quickly, and then she got her own kind of home where she stayed for the whole NICU time. She didn't move again. So
Yeah.
that was really tough, and I don't know, for me that was his home.
Yeah.
Yes, of course.
Yeah.
That's so understandable.
Yeah.
I'm glad that the staff supported you by moving her straight away as well, like understanding.
Yep. Yep. That you needed a different space for her. Yeah.
Yeah, no, that was definitely, as I said, impacted me more than I really would have thought. And then, yes, I finally got a hold of Scarlett, 7 days. She was 7 days old, finally had a hold for a few moments with her while they cleaned her crib. So that was
Was she
really
still on the CPAP at that time?
Yes, she was on
That's good.
CPAP for quite a while.
Wow, good
That would
girl.
have been really special for you to have had a hold with her, especially after everything you've been through.
It was really nice. Yeah, it was definitely nice. It wasn't a kangaroo cuddle. It was just a cuddle in the arms, but it was touch. We got to touch her. And it was, I guess, sad looking back because I was there on my own. It was late at night. I had been discharged from hospital, I can't remember, for 3 or 5 days or something after cesarean. And a few days later, I'd got an infection. So I ended up back in hospital for, I think, 5 or 6 days with a cold and on antibiotics. So I was back in there. So I could go up there more often, I think, and see her.
You were
So
closer.
didn't look at that as a bad thing, being back in hospital, because I was close to her. But there's all the way through, and even in the antenatal ward, you know, the feelings have been torn with having your other child still at home and hearing how much she's missing you and crying for you going to sleep each night.
Yeah.
That's really hard as a mum to know that that's happening and you can't do anything about it.
Yeah. Because she was only 1.5 at this point. You said, hey, she's still so
she was
little.
just over 2 when they were born.
Yeah.
She wouldn't have understood.
And there's no FaceTime back then. There's no video calling either. It was just on the phone whenever you got a chance. Yeah.
Yeah. So that was hard. And then I think it was about 2 and a bit weeks when we had Marcus's funeral. And it took me, I think, 2.5 weeks. I was always so petrified that if something happened to her that they needed to be together.
Yeah.
And it took us a little while till we felt a little bit more secure that she was doing better, but she didn't have a good road either. So I don't think there ever would have really been a perfect point where we ever felt safe with her, you know, that she was coming home. That was a long time before we felt that. And she was a few weeks in, and then we developed necrotizing enterocolitis.
Oh my goodness.
No.
Can you explain a little bit what necrotizing enterocolitis is, just for the listeners?
From my parent perspective,
Yes.
I think the bowel gets sick. It's too early for, you know, it's not mature enough to have feeds and things like that. So, so her belly blew up like a big, huge football with these 4 little like sticks, arms and legs popping out of it.
Wow.
And it was only a few days after we'd started to have more cuddles. So my husband was like, no, we're not cuddling her. We're not touching her. You know, he just really distant. Like, no, we don't want her to get sick. So luckily for her, she didn't require surgery. So she was very luckily treated. They stopped her feeds and on fluids and things. So, but she was about a few weeks off foods and obviously lost some weight during that time. And then for nearly the whole of her NICU stay, she just still had the distended big belly. Even when she was getting bigger and older, it was all belly.
Yeah.
And that would have been quite scary too, because that was like the indicator that she was unwell. And for that to stick around and then potentially some days look bigger than other days, you would have been like always watching and always seeing if she was okay.
Yeah, there wasn't really a time where I can say I felt confident that she was coming home.
Yeah.
That's scary.
Because how long was her stay in NICU?
She was in there 4 months, so she came home just around her due date. So she did do quite well considering all the things that she had been through. And it took her a few goes to get off CPAP. She was on CPAP for, I can't actually remember how long, but I know it was a little while. But it took her 2 or 3 times to actually get off it completely. Then she went to low flow. And then during that, when she started to get into, the gestations of 30 plus weeks, she started to have her eye checks as well. So she was diagnosed with retinopathy of prematurity as well. So she got ROP, and that progressed to needing surgery, laser surgery for her eyes. So she was transferred out to have that at another local hospital. And that was, I don't know, we were told, they'll go in for eye surgery, they'll be intubated, but, usually come back and breathing to what they were before they went into the surgery. So she was having retinopathy surgery on both of her eyes. They were both at that stage of needing that. So she went for surgery, and we did the waiting game as parents do, sitting there at the hospital, shallow breathing, trying to keep busy or distracted, not think about what was actually happening. She came back from surgery a few hours later, and she was actually still intubated. So they were just like, she just needs some more time, we'll see how she goes. So
I guess you prepared for her not to be intubated. So you were like, oh my God, what is happening?
And it
that's scary.
Would have been triggering for you as well because Marcus was intubated.
It was very scary because, we thought she'd come back and she'd be back on low flow. Like she went in, she was starting to have suck feeds before surgery. She was on low flow, almost ready to come off that. And then all of a sudden she wasn't awake after the surgery. So it was definitely very tough. And we, thoughts go through your mind. You're like, what has happened? What's wrong with her? How can this be happening? We're so close to going home now. And that went on for 5 days. So they couldn't find answers as to why she wouldn't wake up or regain consciousness. And once again, another amazing NICU team that's still, so bonded and connected with those doctors today. I remember getting a call on a Saturday night and saying to me, I think we've got a diagnosis. Can you come in the morning? And the next day walking into a room full of healthcare professionals of every kind of specialty you can think of.
Wow.
Thinking what's going on. And it was at that point they felt that she had central anticholinergic syndrome, which is a condition that people can't get rid of the anaesthetic in their system.
Thank goodness.
So, and they hadn't really seen it in babies before, but then obviously a low percentage of babies have surgeries. So what they put it down to, that there was about 500 drugs or medications in around that could impact this, and that they felt maybe it was the eye drops. So they changed her eye drops, and within hours she was starting to move. She was starting to wake up, and she was finally able to breathe on her own again. But it was a really, really harrowing experience.
Yeah,
That would have been so scary. Like, I've never even really heard of that happening in
neither.
babies ever.
Me neither.
And when she woke up, you would have just felt so much relief after 5 days of her just being asleep.
Completely. Yeah, it was.
And was she like asleep? Was she moving? Was she doing anything, or was she fully just asleep?
What they thought was the eye drops were keeping the anaesthetic in her system. So she was basically, I think from my understanding, under anaesthesia for 5 days.
Wow. That's crazy. I've honestly never even heard of that. So.
And then what does that mean for her forever? It means I've told her she can never have surgery again.
No more.
Ever again.
Which has been scary. So far she hasn't, apart from obviously a lot of lifelong challenges for her with her eyesight, and she's had glasses since she was 3, and she can drive, but she doesn't do nighttime driving anymore. She's had cataracts, so she just had one eye about 12 months ago with cataract surgery, so they were able to do that under a local, even though that was really scary for her. It was like, she's not going under anaesthetic.
Yeah, absolutely.
So yes, we're not going to do the second eye at the moment because there hasn't been a huge benefit with having that. So so she adapts.
She's still keeping mum on her toes.
She adapts, yes, that she is.
And what other challenges is she facing after coming home from NICU? Was there any sort of physio, OT as well that she needed?
Yeah, she needed quite a lot more than Madeline. So we did speech therapy for many, many years, I think nearly 3.5 years, and physio and OT on and off over those years as well. So she did need a lot of extra support. She did need some extra support in school as well. I'm sure you hear about it a lot working in the NICU, but when there's extreme prems, their memory's not that great. Following instructions, all that executive thinking kind of thing takes longer. So she did have some extra help, but the schools have always supported her with that, and her family and us as parents, we've always supported her with that. So yeah, really proud. She's just turned 21. Really proud of her. She's a disability support worker and about to finish
That's
another
amazing.
to go in to
Wow.
do school officer support for special needs children. So she's very compassionate soul.
Yeah.
That's amazing.
What a beautiful heart she
Yes.
has to give back that way. That's amazing. Really, really good.
I can just imagine the person that she is. Like, I'm just thinking about it now and I can just see it.
That's really special.
Yeah.
Really special. And so then what was it like taking her home?
It was a lot. It was a lot. I remember you're obviously extremely tired when you have children and babies. And I remember in that first 12 months was a few months of going home. And I remember, and I don't share this a lot, but I remember being in my wardrobe on the floor crying.
Yeah.
And my husband coming in and going, "What's wrong?" And I just said, "I don't want to live like this anymore."
It's so hard.
It was the grief, the bereavement, the guilt, the fear of what would happen to my children, like the changes in me. I was a different person. So it was a lot. Yeah, it was a lot to process and deal with. And I wouldn't say I don't think you ever really recover from it.
Yeah.
I think it's just how you learn to live your normal with that being part of your life or part of your story. So that's some days easier than others. But Scarlett was about 12 months old, I think, when I got a call from one of those first beautiful mums that I'd met in hospital with Maddie to say that, some ladies were getting together at the hospital to talk about some support for other families. So, yeah, I went along with Scarlett in the pram. Maddie was at preschool and went along and met a bunch of other women who'd been through similar experiences with their babies.
That's so wonderful that you had that support with you. Can you talk a little bit about how Miracle Babies came to be? Like, what was that journey like and who kind of started it all?
Miracle Babies was formed by an amazing group of passionate mums who all had their neonatal experience, and we brought to the table different unique journeys of having our children, and from that we were able to identify areas where we wanted to help and give back to the hospitals and support other families. So it definitely started from lived experience and pure passion, and from there along the 20 years we've had so many people be part of Miracle Baby's story that it wouldn't be where it was today without every single person who have helped and supported, volunteered, been staff, donated, attended events, so much. It's been such a huge, huge full village of people.
How special all you mums getting together to support other mums through your journeys.
Yeah, definitely. I think it was also a good healing space for a lot of us as well. I didn't share a lot of my journey for quite a while, but once I started to build some really trusting relationships with these women, which a lot of them are lifelong today still, it definitely can be a really healing space to have that connected person who's been through something similar. It may not be the same, but a lot of those similar emotions that we go through.
And how did it look like at the beginning? What was the support you were giving mums, and then how did it evolve into what it is now?
We met and talked a lot about what we'd been through ourselves, and from there we started to, I guess, identify some gaps in the systems where we could help and bring support and some guidance and hope to others that were in that situation where we were. So it was really built on different parent experiences. We all had our own different unique experience, so I think that brought so much to the table as well. And from there, and then having conversations with healthcare professionals, looking at how can we fit into the hospital unit to be able to provide families this support whilst they're in that really critical time with their baby in NICU.
Can you tell us about Miracle Babies? Tell all the listeners about Miracle Babies. What is it that you do? What types of things do you bring to the hospitals? What initiatives do you have on at the moment?
Definitely. So very proud as a result of my own personal experiences that I've been able to, form and be part of this special foundation. So we're celebrating 20 years this year in 2025.
Congratulations.
Yeah, it's exciting. And over that time we've evolved and expanded, and we've just achieved so much that we never really saw in those first kind of 2 or 3 years. So it's definitely been a lot of growth along the way. And we are, Australia's leading organisation that support premature and sick babies and their families. And we are committed to our purpose, which is to improve, support and enhance all lives impacted by a premature or sick birth. So yeah, really excited by what we do. There's a range of things we do.
I can even just tell in the way you're talking
Yeah.
how passionate you are about
I
it.
definitely am.
It's so good to see,
Yeah.
honestly.
Yeah, so our family support program, it's all peer-led, it's all parent-driven from, people's own experiences, their compassion, wanting to connect with others. We have a 24-hour support line, and that's really important. People say, why is it 24 hours? Having been there, we know that if you're going home from the hospital at 10 o'clock or 11 o'clock at night, and then you're back up at 2 o'clock to express your milk, there's sometimes the moments that are really hard when you're on your own, you don't have anyone close by to talk to, and and so we know that those tears can come at that time, and wanting to, kind of connect with someone is really important. So we do stand by our 24/7. It is hard, to find, volunteers and people to assist with that, but we just believe it's so important. You can't put a time on when you're going to need that support.
That's right.
The baby in care. So, and then we have what we call is our nurture time. That's in hospital support. So that's providing cot-side support to families while their baby is in the unit. We're very big champions for zero separation. So that's why we, encourage cot-side whenever we go to a hospital and have those discussions. We don't want, parents to come in to then have to go out of the room to get support. We believe that parents should be able to be supported by the baby's bed.
That is very important.
And everyone that works at Miracle Babies, do you all have a bit of a story to tell, or like are you, what can I say, like connected to preemie babies in a way, or is it just everyone that's, I don't know what I'm trying to say, but do you understand what I'm trying to say? Yeah.
All our program teams, so that's staff and volunteers that have interactions with hospitals and families, they've all had a neonatal experience. So whether it's a premature birth or a baby, born at term that was critically ill that spent time in hospital as well. So all our program team must have had that experience to provide peer support.
Yeah.
We
Yeah,
also
that's
have an amazing head office team, which are very skilled and talented in whether it's marketing or fundraising and things like that. Yeah, we've got a mix, but everyone that does work in or volunteer in our programs is directly related to a neonatal experience.
Yeah, that's good, because sometimes as a mum, all you want to hear is, or speak to, is somebody that's been through a similar or like a NICU experience, and it's really comforting talking to somebody that has experienced the NICU life.
Yeah, absolutely.
Can I just say it is very incredible that, after your journey and after everything that you've been through, that you've built such an amazing space, company, organization that, provides so much for these families. You really do make a difference in the hospital every single day. So thank you for creating this.
Thank you. As I said, one of, amazing thousands of people along the way over 20 years. It's definitely been a long road. And what has grown out of our experience as well with when I mentioned earlier, the Premier Play Group, we actually were able to take that out into the community and have that more broad. So instead of having like criteria around under 30 weeks or under a certain weight, we were able to open that up to all neonatal babies. So babies that were born, a little bit later at 30, 35 weeks, were still able to access this support. We run them, and they're called our nurture groups. So they're a specialised play and support group for families after babies discharged, and they're nationally, so families can access them. They're not everywhere yet, but we're certainly working on expanding them to be in more regions.
Honestly, it would be amazing. I know there's lots of parents at the place I work at the moment. They would love that, honestly, because, you make friendships in the NICU, as you said, and, you make really close bonds, and it's nice to hang out with those people that have been through similar experiences.
If somebody was looking to join one of your nurture play groups, how would they find that information and whether it's available in their area?
We've got a really extensive website, so anyone can head to miraclebabies.org.au, click on support, and it takes you through to all the hospitals where we're currently working face-to-face with families, also all the community areas that we're working in with nurture groups. So you can jump on there, have a look, and just click to register. It's a very simple and easy process. And the other part we're really proud of too is while the families are in hospital, we have a really good extensive resource kit, so families can get support, right at baby's admission with the NICU survival pack. It's got an information handbook that's been written in partnership with parents and healthcare professionals, and some other like ways to journal and keep memories of your time in hospital with your baby. We've got emergency care packs for mums who have to go to that appointment like I did and don't have any supplies packed with you. So 48 hours of emergency hygiene supplies. We have milk express packs, so for mums when they're expressing their breast milk, a cooler bag so they can safely transport to and from the hospital.
I see those cooler bags a lot around the hospital.
They are. That's good.
They're
That's great
incredible.
to hear. We know water's important for mums that are expressing. So lots of information around how they can safely do these kinds of things and be there for their baby. And we're big champions as well for, family integrated care, kangaroo and skin to skin care. yeah, anything where the parents and the family can be more involved in baby's care. We do lots
Yeah.
of campaigns, we do lots of events, we do lots. So please
Mhm.
jump online and have a look, because there's
Yeah.
certainly a way that everyone can get involved.
Yep, and we'll link Miracle Babies in our bio, in our link tree, so everybody will be able to jump over to you and actually be able to get the support that they need. Yeah. So you were saying with the twins, you were in hospital for 4 months, is that right? Before you could come home. And so financially, what did that look like for you? And what did that look like for your husband? Because I assume he had to go back to work pretty much straight away, or maybe after like a week or two. And then you wouldn't be able to go to work when you've just brought your baby home as well. So what did that look like financially for you as a family?
It's really difficult while Scarlett was in hospital for those 4 months, and I had Madeline at home. So I couldn't be at the hospital as much as I wanted to, because I didn't have anyone to assist with Maddie to care at home. And while at that time I could bring her into the unit for a little while, it certainly wasn't the most
Yep.
easiest of places for
Mhm.
a toddler of 2 years old to be running around. So that was difficult. We could get in there for a little while, but if she got tired or bored, or we kind of had to go from there. And then I'd go back later in the evenings when my husband was home. But it limited, I guess, the time that he could go into the hospital as well, because I was going back in at
Yeah.
nights. And yeah, he had to work. So, you know, we still had bills to pay. We still had to buy food, clothes, all of those things. So he only got time in between his work and
Yeah.
didn't have any actual leave to just stay at the hospital with me for a certain period.
And what kind of maternity leave was available to you at that time? Was it government based? Like, what was there for you?
I wasn't working at the time because I was home with Madeline, but there certainly wasn't anything around like what is available today. So there's
Mhm.
definitely been good improvements there, but we still believe there should be more for neonatal
Yeah,
families.
definitely.
Yeah.
Especially if you're like you on bed rest from 16 weeks. That's a really long time. And especially you want to be home when your baby goes home. You don't want to have to go back to work. So tell us a bit about the leave and the sort of campaign you're running at the moment.
Miracle Babies has been advocating for changes for neonatal families for quite a few years now.
Mhm.
So we're certainly hoping that all sides of government have a closer look at this, especially during this election, because it needs to happen. We know that so many of these families are going home using all of their paid parental leave from the government before the baby's home. And that scheme's designed for families to be at home together, for bonding, for all of that extra support. But yet the most vulnerable babies that are born so extremely preterm or really critically ill at term are going home without that opportunity. So we're calling on the government to change that and to add in a critical care neonatal leave payment for these families so that all babies get to go home. So when these babies that have been in there for weeks or months get to go home, they still get to go home with that same paid parental leave entitlement that their peers received from having a full-term baby.
Yeah, that's amazing.
a great idea.
That's really beautiful. And so, what does that look like? Do you submit a form to say, yep, I was in the NICU for 12 weeks? Or is it like a week by week basis where you submit documents to say that you're in NICU and you get payments that way? How does it kind of look to receive those payments in what you're campaigning for?
There's some research that's come out that one of the biggest needs that parents have reported on is needing that extra care and that time with their baby when they go home. We're looking at a framework where any baby that's in neonatal care over 2 weeks will receive 1 week in hospital as 1 week as a neonatal critical care payment, and up to a maximum of 14 weeks. So we're not talking a huge amount of families that will fit into that criteria, but we are talking about families that are really vulnerable in needing this extra support. And yeah, we really believe Australia can do this and do it better. The research that we're looking at is whichever partner, you know, chooses to be at the hospital at that time as that person, but definitely some extra leave for dad or partner if that's where it falls. But definitely a few weeks extra, like 2 weeks as it is at the moment, isn't really enough. And then same again, it's if they use it in hospital, they don't get it when their baby goes home.
It's exactly right. And I see so many like parents in NICU at the moment, and dad going back to work is such a major thing. Like it brings so much like, heartbreak to the mum. She feels that she has to do this on her own now. The team is broken up because somebody has to go back to work and provide, and it does suck.
It does. And I look back to those conversations and meetings that we were having with doctors when, Marcus was sick and then when Scarlett was unwell as well. And I can't imagine having to just do that on your own.
That's
to
right.
have your partner with you to be able to support each other, and then to find the words to have to repeat that to them, what happened in the meeting. Like,
And to remember the words as well, it's really shocking hearing that stuff, and sometimes you can't remember what they say. So it would be really nice for both parents to be able to be there to experience it all.
it is, and it's so needed. Like, we know there's so much evidence and research around all the things we need from parents for a baby in neonatal care to have a better outcome. We know we need breast milk.
Yeah.
We know kangaroo care has so many great benefits. Parental confidence, and the parental mental health side is huge. We know that there's so much mental health concerns going on for families, and yet we're not
Not only
getting
that, just to advocate for
right.
your baby, having both parents there advocating for your baby, your baby the most. So both being able to be there, or even just one, is really changing for the baby.
It definitely can make better outcomes, and we want all families to go home and thrive, and we need for the whole family unit to be doing well for that.
Yep.
Yeah, so advocating hard. Lots of families have been sharing their stories, so everyone can help out. You can just jump on our website once again, miraclebabies.org.au, and there's a place where you can submit your family story to talk about how it's impacted your family by either having to go back to work earlier, or sometimes, we're losing good women from the workforce as well, and we're putting these, vulnerable babies into childcare earlier than they probably should be with their medical conditions and challenges. So there's a lot of reasons why this is needed. And yeah, you can do that. And you can also please write to your federal MP coming up in this election. So, we've got quite a few weeks still. Please keep those letters rolling in. There's templates on the website, and you can also find out on our website who your federal MP is. So the more noise and the more community conversation we can have, hopefully we can make some change together.
This is fantastic, Kylie. This is really fantastic.
Really good. And then one of your other programs as well that I really like is the Nurture Time, where you've got an employed person from Miracle Babies going cotside into the NICUs. If a mum is really wanting to do that, or if she's really connected by that story where she wants to become one of those people where she can do that for other mums, is there a way for her to contact you on your website to be like, I would actually really like to do that course to be one of those people that is in hospital? Is there a place where they can do that?
Anyone can definitely reach out and ask for ways they can help in their area and what's available. We do have, several unique roles, which are paid staff members that actually get to go in and support these families in the neonatal units, and they have had their own neonatal experience themselves. So it's a very rewarding role. It can be healing, but it can also be quite challenging because this is the trigger point for their trauma as well. So we do have a lot of training and mentoring around those roles, but definitely reach out if you're interested in getting involved in any way. Families need help right across Australia. So, hopefully we can find a way that you can help us deliver our purpose.
Yeah. And then I know that you had one more baby, is that right?
I did.
Yep.
So I actually went and had more surgery again. So I think I can't count how many surgeries I've had, but had more surgery, and I actually had a transabdominal circlage put in pre-pregnancy.
Wow.
So that was done by laparoscopy. I hear it's quite more common now than it was back when I had mine done. I was the second person in my area to have it done, so it was quite new at the time. And yeah, it was the next step and what we needed to try, I guess. But it definitely worked. I still went for fortnightly ultrasounds every 2 weeks, but I went right through to a booked cesarean at 38 weeks.
Wow.
Congratulations. That would have been so relieving to get to that point and finally have a term baby.
Finally, yes. And he was about 3.6 kilos, so he was a
Big boy.
Wow.
Yes. So, but yeah, I remember being close to 38 weeks and just back pain and thinking, oh my gosh, I can't say anything. This is what it's meant to be like. I just deal with it. But yeah, it was definitely a different experience to be awake during the cesarean, to be able to hold him straight away, to have my husband there as well. So yeah, very, very different experience than anything we'd had before. And it was nice to finally have a little bit of what it can be like for most families.
I think that is beautiful that you had that for your final experience. I think that brings a lot of hope to any NICU mums that are listening on the podcast as well, that even though they have had a preemie previously, there is still hope and they can still, make it to term and have that term baby that they,
that they all hope for. Yeah. And tell us a little bit about that experience where you've just had a term baby. You see what they look like, 3.6 kilos. do you ever have that feeling of, you know, this is what the other baby should have been like? This is what, do you know what I mean? Like, did you ever have that grief of like you felt like your body let you down or that you didn't have, you know, and it's nothing to do with you, nothing your fault, but you know, mums take on that guilt of like it wasn't like I wasn't able to carry them to term. Did you ever have those feelings?
Huge amount of guilt all the way throughout, through infertility, through everything, always a lot of guilt. Yeah, like something that my body as a woman was designed to do, couldn't do properly. So certainly go through a lot of that. And still to this day, you know, I don't think you ever really get over that. But there was definitely, I think, some healing when I had Liam, and, you know, we, you know, followed medical advice and we tried to, you know, kind of fix as much as we could through surgeries and things like that. So it was nice that we could give him, you know, that different start of life, I think.
Yeah.
But part of, I think, of the healing was as well that he's had some challenges as well at term. So I think that healed me a little bit as well, that, you know, not everything that has happened, you know, can be blamed on my cervix, I guess.
Absolutely.
So with Liam, did he come with you to maternity like straight after you delivered him, or, you know, at 38
I
weeks?
was in recovery for a little while, so he went down to the ward with my husband. Yeah, which
Your
wasn't
husband would have been like, oh my God, what is this experience? Where are the monitors?
Yes, it was very different. It was like, oh, we have to feed him. Oh, how does that work?
Where's the tube?
Straight away.
So definitely a different experience, but yeah, thrilled that we finally got to have that experience.
And was it just a few days that you were in hospital at that time? Was it just 3 or 5 and then you were able to all go home?
Yes, so it was just a very small stay. He did go up to, I remember he went to, one of the doctors came down to visit us and he was a bit worried about his breathing. So he actually went to NICU for a couple of hours till the nurses were like, take that baby back down to that pool.
He is fine.
They just wanted him to go and visit the NICU, see
I think he
what's
just
it all
wanted to
about.
share in the family history, yeah.
Oh, and so how old is he now?
He's almost about to turn 18. He's, yeah, very proud of him too. He's an apprentice tradie. He's loving life.
Wow.
Yeah, very proud of him too.
That's
Good on
incredible.
him. That's so lovely.
It's good that they have a amazing mom and dad backing them, you know. They wouldn't be the kids they are without you guys.
Oh, it's definitely a community that's helped us all along the way.
Yes, that's right.
And you said the picture behind you reminds you of your kids.
Yeah, can you tell us about
I did. I love this. I found it just in a chemist one day and it just instantly reminded me of my children. Like the little one reminds me of Scarlett. She's our petite 25 weeker. She's still quite petite. Maddie's tall and strong and Liam's very tall and strong and he's quite quirky. So
I love it. I love it.
Oh, that's so beautiful.
Is there anything else you'd like to share with us, Kylie, that we haven't covered today?
I think I've probably shared a lot with you. So hopefully
You have.
if I have anyone's been upset by hearing my story, please reach out and call our nurture line because yeah, having this kind of experience and trauma and sometimes retelling it is hard no matter how many years has gone past. So definitely reach out if anyone would like to have a chat or get involved in any way. There's lots of ways people can help. We have wonderful knitting and sewing volunteers that do things for campaigns for hospitals and keeping babies, you know, warm with their beanies and things like that. So there's lots of ways that people can get involved. We have events coming up quite often, you know, in Sydney, Perth, Melbourne. So please jump on our website and engage with us and help us along on this journey to help neonatal families.
Thank you so much, Kylie, for sharing your story with us today and telling us about Miracle Babies and about all of the most amazing things that you guys do with your organisation.
Thank you for having us to share what we do and what Miracle Babies is and means for so many families. So, yeah, thank you for helping us get the word out there and letting families know how they can get support.
And we're very proud to be like supporting you guys as well, like
Through this podcast.
through this podcast.
Absolutely.
We're really proud to be, you know, associated with you. So thank you so much.
Thank you, ladies. All the best with it. I'm very proud of you all and excited for you all.